Let's reach for these oranges.
Here are some more examples, some becoming more complex as we go along. These might give you some more ideas of what you could do in your treatment setting. Here I'm having Harriet make some orange juice. This activity uses the upper extremity in the 3 ways we've been talking about, by having your patient use it in weight bearing or as a stabilizer, by guiding the patient with your hand over theirs, or having them do a portion of the activity bilaterally. This is an activity that I really like because it is simple. It can be done in almost any setting. You can do this if you work in a hospital, a nursing home, a rehab center, or if you're working in home health. It requires almost no equipment, and you don't need to have a big kitchen. It can be done with both low-level patients as well as high-level patients. I also like this activity because it can be done in one treatment session, start to finish, and the patient will have a sense of accomplishment.
Let's reach for another orange.
As I guide her hand, I'm also careful to support the weight of her arm by putting my other hand under her elbow. When cutting, I use a knife that is sharp enough to cut, but for safety, I always put the knife in the weak hand so I'm in control, and I guide her hand and the knife. Watch how I also put my other hand over her strong hand to keep her fingers safe and away from the knife. I don't worry if the pace seems slightly slower than normal. I know that it may take a bit longer for my patient to process what we are doing, and for her it might be just the right tempo. I take my time. I'm not in a hurry, and I want her to participate in as much of the activity as possible. The size and the shape of the juicer is perfect for Harriet's hand. In fact, that's one reason I selected this activity for Harriet's treatment today. It is large enough to keep her hand in a nice, open position and also gives a natural amount of finger flexion. I would also use this for patients with higher tone because it helps to keep the fingers open and to inhibit their tone. As she stabilizes the juicer with her involved hand, I see that I can even take my hand away. Her hand is not curling up or increasing in tone. Sometimes I guide both hands. I'll do this if the patient isn't sure what to do, if they are apraxic, if they have motor planning problems, or if they just don't know what to do in the activity. In this case, Harriet is having trouble just getting enough pressure through her hand to squeeze the juice out of the orange. After she's been working at this for a while, I'm sensitive to knowing when she's had enough. You don't need to fill the whole glass. Just enough for her to take a few sips can still give her a feeling of success. I always include wiping down the table. It's automatic for most of my patients. It's easy and simple to do, and again, I can easily include those 3 ways of incorporating the non-functional upper extremity into treatment. If there is a big area to clean, I'll even get more trunk rotation. I'll get more weight shift and more scapular protraction. All of these will help my patient to get more dynamic trunk control. Using the non-functional upper extremity in weight bearing as a stabilizer facilitates weight bearing over the involved side, encourages use of the involved side, and improves awareness. Guiding the involved upper extremity promotes normal sensory information, facilitates normal patterns of movement, and encourages compensation for visual field cut. Bilateral use of both upper extremities helps the patient to incorporate the involved side without assistance from the therapist, promotes symmetry, and facilitates dynamic trunk control.